Alzheimer's disease is named after Dr. Alois Alzheimer. In 1906, he noticed changes in the brain tissue of a woman who had died of mental illness. Her symptoms included memory loss, language problems, and unpredictable behavior. After she died, he examined her brain. He found many abnormal structures which are now called amyloid plaques and tangled bundles of fibers which are now called tangles. These plaques and tangles in the brain are still considered some of the main features of Alzheimer's disease. Another feature is the loss of connections between nerve cells in the brain. Abnormal deposits of proteins form amyloid plaques and tangles throughout the brain, and once healthy neurons stop functioning, lose connections with other neurons, and die. There are many risk factors of Alzheimer's disease such as age. Increasing age is the greatest known risk factor for Alzheimer's disease. Risk increases greatly after a person reaches the age of 65. Family history and genetics. The risk of developing disease increases if any family member has the same disease. Down syndrome. A gene contained in the extra chromosome that causes Down syndrome significantly increases the risk of Alzheimer's disease. Sex. Women seem to be more likely than are men to develop Alzheimer's disease because they live longer. Head trauma. People who've had a severe head trauma seem to have a greater risk of Alzheimer's disease. People with Alzheimer's may experience depression, social withdrawal, mood swings, distrust in others, irritability and aggressiveness, changes in sleeping habits. Diagnosis for Alzheimer's disease include lab tests, mental status and neuropsychological testing, brain imaging. Scientists don't yet fully understand what causes this disease in most people. In people with early onset Alzheimer's disease, a genetic mutation is usually the cause. Late onset Alzheimer's disease arises from a complex series of brain changes that occur over decades. The causes probably include a combination of genetic, environmental, and lifestyle factors. The importance of any one of these factors in increasing or decreasing the risk of developing Alzheimer's disease may differ from person to person. Treatment for Alzheimer-affected individual includes maintaining mental function, managing behavior, caring for a person with Alzheimer's disease. Drugs to treat problems with mood, depression and irritability includes citalopram, fluoxetine, paroxetine and sertraline. For people who have anxiety or restlessness, medicines includes alprazolam, buspirone, lorazepam and oxazepam. To ease confusion, aggression, agitation or hallucinations, medicines include aripiprazole, haloperidol, and olanzepine. Consumption of fruit and vegetable juices was associated with decreased incidence of Alzheimer's over 7 to 9 years of follow-up. Berries contain high levels of biologically active components, including a class of compounds called anthocyanosides, which are beneficial for memory impairment. Anthocyanosides fight memory impairment associated with free radicals and beta-amyloid plaques in the brain. Eat berries each day for maximum benefit. Levels of docosahexaenoic acid found in fatty fish like salmon, mackerel, and tuna, measured at baseline had lower rates of Alzheimer's over 9 years of follow-up. These fish are all rich in omega-3 fatty acids. Take folic acid supplements. Drink a glass of purple grape juice with your evening meal. Components in grape skins protect brain cells from the toxic effect of oxidative stress and beta-amyloid proteins. Control your blood pressure by exercising regularly. Drinking plenty of water can remove toxins and it is also needed for healthy and effective lifestyle. adherent to the Mediterranean-style diet had a lower incidence of Alzheimer's, compared with those who did not follow this diet.